We have to get very serious now. We have to talk about one of the most disturbing subjects humanity has had to deal with. So much so that many places don't even want you to use the word. Some have tried politically correct terms like self-deletion. Others, a more genteel, took their own life. Either way, we're talking about people who have made the ultimate decision that there is no coming back from, ending their own existence. However you phrase it, it's an issue deserving of our utmost compassion and empathy. However, in the case of pain patients, people in general, and government in particular, wave it off, blame the victims, and generally just don't care. We've been dancing around this issue in the first 4 parts, and now it's time to give you that information in full. We'll start with an episode of the podcast which shows that the CDC guidelines are directly responsible for an increase in suicides among chronic pain sufferers. And this week he goes to all the drug warriors and other busybodies trying to oppress pain sufferers with the bogus opioid scare, which we've covered quite a few times on this podcast, and I think you were here for one of those, Chris.
Oh, yeah.
Well, the problem, of course, is all of those horrible, evil doctors prescribing them, and if we just stop that, everything will be all better.
Yeah.
Except a report from the IQVIA Institute for Human Data Science. Opioid prescriptions, which had been continually rising up to 2011, began falling at that time, and they fallen a total of 29% between 2011 and 2017. And guess what? That's the same time as opioid-related deaths began accelerating. They'd been rising steady up to that point, basically like a linear, but after that point, they started rising exponentially.
It actually reminds me of this funny thing that was making fun of it war, where it shows a senator banning opioids, and then he later reads, people are dying from black market opioids, and he's like, God damn it, how come every time us good, well-intentioned politicians pass a law, the black market has to come around and ruin it?
But even when you take out heroin and fentanyl and just look at synthetic opioids, before 2011, they'd been rising maybe a tiny bit, but was fairly flat. They accelerated big time around the time prescription opioids were moved to Schedule 2. Gee, thanks, Barry. And Trump seems bent on continuing the same misguided policy.
Yes, there are people who are legitimately addicted to opioids, but addiction is a symptom of a much greater problem, and by banning the drug, you're only putting a bandage over one of the symptoms, and you're not treating the other problem, because even if the person who's addicted decides, I'm going to give up taking opioids, he's just going to substitute his addiction with something else.
Well, yeah, but in addition to sending them to the black market, and I mean, pain is a huge motivator in that regard, pretty much any psychiatrist or psychologist will tell you that if you're trying to figure out someone's risk for suicide, consider their pain levels.
Oh, yeah.
Yeah, I mean, then there have been people who have lost their opioids trying to deal with chronic pain. They haven't been able to deal with it without it, and they've committed suicide. Well, and the opioids don't get you out of pain completely. They just take it down to a level where you can just kind of muddle through the day. So what do drug warriors like all statists do when their policy is shown to be completely and utterly not working and even backfiring? Well, they double down, of course. We're obviously not doing enough.
Yep.
And the patient died because we didn't use enough leeches.
Yeah, I mean, it's like, what? The bailouts didn't save the money and many companies went out of business and stopped lending? Well, that's because we didn't give them enough money.
Yes, the DEA has reduced the number of prescription opioids that can be produced by 25% last year and another 20% this year, and they've announced plans to restrict it even further. And they claim that this is based on legitimate medical needs of patients, not the number of pills expected to sell. But the number expected to sell is based on the number of expected prescriptions, and that, in turn, is based on patients' legitimate medical needs.
Actually, that reminds me of that one guy who was in a similar situation that you had. That one time he was in a terrible car accident, only he was actually in a wheelchair because he was in so much pain and he was partially paralyzed, and the DEA raided his house, pointed guns at his children and all that, and arrested him, and they said, well, he had too many pills. We found over 40 or 50 pills, but then several doctors pointed out, that's about a basic week and a half's worth of prescription.
Yeah, I get them filled 90 at a time. But this is what government always does in both healthcare and the drug war. They substitute their own judgment in place of licensed and qualified medical professionals who have actually examined the patient in person. If anyone else did that, it would be practicing medicine without a license. But for government, it's all in a day's work.
And that's also a reason why healthcare is so expensive and why people are having difficulty finding doctors these days. It's because it's so freaking difficult to become one these days, And I actually read somewhere that, there was one medical student who said the worst part about going to medical school isn't, learning all the complicated disease terms and all that. It's actually taking the courses where they teach you just how to deal with government regulation and how to protect yourself from legal trouble.
Well, ask anyone who's on Medicare or Medicaid how difficult it is to find someone who can treat them for something.
That's why I don't believe for a single second that you say we only care about the rights of the patient, because you don't.
And now we come to the cause for absolute outrage. Most of you are going to need to steel yourself before listening to this. And as for the rest, well, after hearing this, if you aren't furious and indignant at the CDC, you just have no heart. The CDC has been deliberately lying about pain patients, and it's time to find out the reprehensible reason why. The CDC is not an organization of science. They're an organization of politics. As regulars know, back in 2006, I was hit by a drunk driver. I've got chronic pain. Barring a medical advance, I will be in pain every single moment of every single day for the rest of my life. And unless you are faced with that realization, you are not in any position to judge any pain patients. And yet that's exactly what the CDC has done for completely political reasons. This first article on Pain News Network covers the idea that we've talked about before about pain patients and suicides. When you go looking around on all those pain management forums and things like that, and you actually read what other pain patients are posting, a very common phrase that they'll use is they have a plan in place. You know what a plan in place is? It's how they're going to end their own lives should they ever lose access to their medicine. Let that sink in. Because these people, without opioids, they would have such a low quality of life that they would commit suicide. That is not an addiction. That is a medical problem that they need this for. It raises the question, how many people who commit suicide because they're pain patients who just can't adequately manage their pain? Well, we don't know, because the CDC doesn't even bother to count it. Because a lot of people say we're in this suicide epidemic right now, just like we're in the opioid epidemic. They love using the word epidemic for things like that. So the number of Americans who die by suicide, which is almost 45,000, exceeds overdose deaths linked to both illicit and prescription opioids, which is a little over 42,000. And according to CDC Deputy Director Ann Suchat, unfortunately, our data shows that the problem is getting worse. These findings are disturbing. Suicide is a public health problem that can be prevented. And the CDC is really concerned with this, but not concerned enough to actually consider how much of it is because of chronic pain. While CDC researchers can go into great detail about the methods, causes, demographics, ethnicity, and even the drugs used by suicide victims, they did not investigate anecdotal reports of a growing number of suicides among pain patients. And this is Suchat again. Our report found that physical health problems were present in about a fifth of individuals as circumstances considered to lead up to suicide. That doesn't differentiate whether it was intractable pain versus other conditions that might have been factors. Asked directly if lack of access to opioid medication may be contributing to pain patient suicides, Suchat said that federal agencies were working on comprehensive pain management strategies, but they were not investigating patient suicides. We don't have other studies right now, But I would say that the management of pain is a very important issue for the CDC and Health and Human Services. But not enough to look at their suicides. Nope, it's an important issue because pain patients are a nice little scapegoat, nice little something they can point to and go, oh my God, here's this problem, the opioid epidemic. People are dying. But as I've shown over and over and over again, and as I'm about to show in this second article, people are not dying because their doctors prescribed them opioids. They're dying because they got illicitly manufactured fentanyl on the black market. And they know this, and they don't care. They are lying. So PNN asked a CDC spokesperson, is the agency conducting any studies? Are you going to try to figure this out? What impact is it having on the quality of pain care? The boilerplate response we received was essentially no. The CDC was only tracking prescriptions. And this is the CDC's Courtney Leland. Through its Quality Improvement Collaborative and its work with academic partners, CDC is evaluating the impact of clinical decisions on patient health outcomes by examining data on overall opioid prescribing rates, as well as measures such as dose and day supply, since research shows that taking opioids for longer periods of time or in higher doses increases a person's risk of addiction and overdose. Lie, 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 lie. This is wrong, and they know it, and I'll prove it in the next one. It's wrong, and they know it's wrong. I've been showing that it's wrong. There's no question that this is wrong. But the CDC knows that it's wrong, and they don't care. The CDC's guideline may be contributing to a rising number of suicides in the pain community. In a survey of over 3,100 pain patients on the one-year anniversary of the guideline, over 40% said they had considered suicide because their pain was poorly treated. Most patients said they had been taken off opioids or had their doses reduced to comply with the CDC guideline, which has been widely adopted throughout the U.S. healthcare system. Many patients say they can't even find a doctor willing to treat them. And I'm not going to read these out, but they're heartbreaking if you want to read them. What readers have actually said, how they contemplate taking their own life. So just keep that in mind. Keep how unconcerned the CDC is about this. Keep that in mind while we go over this next one. About the CDC overdose death data, where the CDC knows that it's collecting its data based on flawed methodology, and they don't change it. And this is from March 24th, 2021. Two researchers called out the CDC over their overdose death statistics in the last decade. In a 2018 report titled Quantifying the Epidemic of Prescription Opioid Overdose Deaths, 4 senior analysts of the CDC, including the head of epidemiology and surveillance branch, acknowledged for the first time that the number of prescription opioid overdose deaths reported by the CDC in 2016 was erroneous. It's wrong, and they know it's wrong, but it gets worse. Because this isn't just 1 year. This systemic error likely began in 2005 to 2007 when the CDC and the DEA identified 1,013 deaths caused by illicitly manufactured fentanyl, that's what they call IMF, that's not International Monetary Fund, it's fentanyl, mixed with and sold as heroin in several Midwestern and Northeastern states. And we've talked about this. Fentanyl is a lot stronger than heroin. And so people think they're buying heroin, they're really buying fentanyl. They take a dosage that probably would be safe for heroin, but it's not. It's fentanyl, and it's too much. This isn't because people, get prescribed medicine and then they kind of go crazy and overdose. They're not trying to go crazy getting on some high. They're going, for whatever reason, to the black market to try to get heroin or something like that. But the black market doesn't have dose control. They don't label. So when you buy that drug on the black market, you don't know what you're getting. You don't know how much of it you're getting. You don't know what it's cut with or what might have been substituted. You don't know. The CDC was informed by Rhode Island authorities that except fentanyl, this is in 2013, acetylfentanyl, a fentanyl analog up to 5 times as potent as fentanyl had been identified in 10 drug overdose deaths in the state between March and April. During and shortly after the month-long investigation, 4 more overdose deaths occurred. Besides the Rhode Island deaths, a CDC field report at the time cited a cluster of 50 similar IMF deaths reported by authorities in Pennsylvania. Despite having information about IMF since 2005 and 2007, the NVSS continued to code all incoming death certificate information that mentioned fentanyl as a single or contributory cause of death as the prescribed form of the drug, a serious miscalculation that would have substantial consequences on public policy, health, and safety. What have I been saying, people? What have I been saying for years? Watch the language. Because they'll talk until they're blue in the face about prescription opioids this, prescription opioids that. As soon as they start talking about the overdose deaths, they drop the word prescription. Because they're no longer talking about prescription opioids. They're talking about black market fentanyl. They're lying, and they know it. And this is proof. The CDC has potentially been compounding the error since 2005. The assumption that patients prescribed analgesics for pain are a significant driver of the crisis is all based on this one flawed ICD-10 code, despite the fact that drawing such an association wasn't justified by the evidence. There is only an assumption that patients like the grandma with a broken hip, or the young woman with autoimmune disease, or the man with cancer were ever overdosing on medications in significant numbers. What the CDC has done by drawing this correlation is known as a questionable cause fallacy. We've gone over that. People are dying from opioid overdoses. Opioids are often prescribed to patients in pain. Therefore, patients are overdosing on opioids. It's a conflation. But none of this stopped several federal agencies from spending billions in taxpayers' dollars to restrict legal access to analgesics. The popular narrative has been that in order to save people from overdosing on prescribed medications, even those who are dying, what kind of mentality is that? Okay, you've got 2 months to live, you're in incredible pain, but we're not going to let you have painkillers because you might get addicted. How these people think is beyond me. It's beyond me. We must further restrict access to the medical supply, even though we really can't tell whether it's patients who are remarkably contributing or whether it's a completely different demographic, e.g., casual drug users and those with SUDs, that's substance use disorders. In fact, many recent observations have appeared to prove the latter. So the pain patients are a completely different group, a completely different demographic than people suffering from addiction or people who are casual drug users, just out looking to get high or whatever. We're a completely different category, people, and yet they're just lumping us in and even giving us the primary blame for it. Some of the CDC analysts discovered their error in the 2016 statistics. That was 5 years ago. So what do they do then? Well, it's all about the science, right? When it's about the science, you go, oh, gee, well, it appears we've been doing this wrong. What do we do? Well, I guess we have to now admit that we were wrong. We have to correct for it. We have to get better statistics with the proper methodology and see how that alters our conclusions, right? Well, just ain't how the CDC operates, folks. Hate to tell you that. They recalculated the numbers, leveraging a more conservative method by removing all the deaths from the ICD-10 code, the one that was said to be the genesis of the error. While this reduced the number of decedents assumed to have overdosed on prescription opioids by a massive 47.3%, pretty much cut it in half, it still can't account for prescription overdose deaths caused by illicitly obtained pharmaceuticals, which essentially means the CDC still has no clue how the remaining 17,000 gained access to the drugs. Because you can buy the prescription drugs on the black market. Considering CDC is unable to parse data from overdoses experienced by casual users and those with SUDs versus patients prescribed analgesics for pain, it is impossible at present to discern how many of these deaths represent patients. Many studies show patients rarely misuse, abuse, or overdose on their medications, so they aren't likely a driver of the crisis. Yeah, I've shown you the statistics on this before. It's far less than 1%. Less than 1%. And guess what? After all this, the CDC still has not modernized its coding system despite the mandate. A congressional mandate said that they had to do this, said that they had to modernize the system for better coding for the cause of deaths. They still haven't done it. They haven't even started on it. The lack of drug specificity limits the value of surveillance data for drugs most often associated with causing or contributing to death. Considering we've known for some time polysubstance use has been the real driver, along with IMF and alcohol, it's curious there appears to be no movement on the mandate to modernize the system. They don't even look at that. They know they're counting it wrong, and they haven't done anything at all to change it. But it's even worse than that. Up to 30% of death certificates. Looks like it might be incorrect. Between 20 and 30% of death certificates received by the CDC are incorrect. This is a problem separate from how CDC codes these drug deaths. While the CDC recommends the submission of a supplemental death certificate once drug results are known, the authors acknowledge this advice isn't always heeded. With few exceptions, the agency responsible for compiling national vital statistics accepts the data without ever verifying its accuracy. And if you don't verify, how do you know? A review of Missouri hospitals in 2017, for example, found nearly half of death certificates listed an incorrect cause of death. A Vermont study found 51% of death certificates had major errors. Nearly half of the physicians the Centers for Disease Control and Prevention surveyed in 2010 admitted that they knowingly reported an inaccurate cause of death. Let that sink in. Half of death certificates are wrong, and they know it? I mean, I thought, like, falsifying a medical record was supposed to be like this big crime or something like that, but they'll falsify a death record, and oh well, who cares? Because it's just those pain patients. I mean, they're every bit as bad as, drug addicts and everything, right? CDC starts its compilation and analysis of mortality data with unfiltered source data, which we've already learned is erroneous up to 30% of the time. Additionally, data can have the added character of being based on preliminary certificates that are not always updated after toxicology results are clear, compounding the problem. And they're also completely missing the signals of abuse. Not only can polypharmacy make postmortem identification of the cause of death impossible, there is an average of 6 substances present at the time of death in a majority of these deaths, at least in cases that had toxicology screening completed. So when they actually bothered to look for it, a majority of the cases aren't just opioids. They've got 5 other things with them as well. They've got, alcohol or, maybe, cocaine or whatever. Despite polysubstance overdose making up the bulk of overdose deaths, the essence of that fact isn't captured on death certificates because, by law, a single cause of death must be elucidated. Dumb law. The reason Americans are expected to give up privacy to a federal agency without even a conversation is so public health can rapidly identify signals about emerging health threats. Bureaucrats can put population health over your individual right to privacy because the ethical framework underpinning public health differs from the one underpinning clinical and bioethics that, in theory, respect informed consent. It logically follows that we tolerate this invasion of privacy so any threats can be rapidly detected and mitigated. Most Americans would be shocked to learn how much private health data is captured. However, repeated warnings about the shortcomings of CDC's data compilation and interpretive practices were ignored. And in the process, They failed to identify serious emerging threats to public health, IMF being one of the major missed signals. The system completely failed to work the way it was supposed to, but Americans are still left holding the bill for a system that, according to this and other reviews, simply doesn't work. Despite the CDC becoming acutely aware of the fact that most of their data appeared to depict the presence of IMF plus multiple other substances, mostly illicit in nature, including drugs like fake Xanax laced with IMF in the majority of victims, CDC was aware of the lack of drug specificity as early as 2005, but continued pushing the narrative that pain patients were driving these statistics via a PR campaign carried out by the firm PRR and through the development and implementation of its highly controversial 2016 practice standard. In fact, PRR was hired to improve the agency's public image and develop a communication strategy to help educate the public about the CDC's controversial opioid guidelines. They didn't change the way they were doing things. They didn't correct their methodology. They didn't start collecting better data. They didn't question their conclusions. They hired a PR firm! Come on! Seriously! My God, what is wrong with these people? Previously stable patients were forced tapered off their medications en masse by frightened doctors who were terrified of losing their licenses. Anxiety in the wake of increasingly aggressive litigation and professional reprimands against physicians and an avalanche of negative media coverage about how doctors were driving the crisis simply by prescribing to their sick and injured patients took shape and has created the climate we find ourselves in today. Yep, we've seen that before. In the other videos I've covered, this doctor was prescribing opioids and then someone overdosed and died. Take his medical license away! Maybe we should put him in jail. Oh, pharmaceutical companies are making prescription opioids? Oh, well, we just need to sue them out of existence and we need to take their CEOs and everyone else and throw them in jail. We've seen that. We've seen that happening. And it's all based on bogus data. There isn't the first bit of truth to any of it. To any of it. This zeitgeist was a direct result of the narcissistic morality of a politically diseased dystopian regime bent on platonic identity politics forced onto vulnerable and stigmatized populations by fiat. A regime that leads to disaster and surveillance capitalism where the rich get richer and the tyranny of the subjective of moral busybodies reign over reason and science. The federal government and state legislatures have funneled an obscene amount of taxpayer-provided funds toward restricting patient access to analgesics and increasing access to low or no evidence alternatives instead of focusing attention and capital on IMF. This, despite the fact that patients prescribed analgesics do not experience a high rate of misuse, abuse, or overdose. Of course not, because that might mean having to admit that the war on drugs is a failure. And we can't do that now, right? We need the war on drugs. We gotta protect the children. We're protecting the children. We're protecting the streets. Oh, crime. Yeah, whatever. Less than 1% of chronic pain patients, and we've seen this same statistic multiple other places, verified, less than 1% of chronic pain patients without a history of substance abuse problems became addicted to opioids during treatment. Similar figures have been observed in several other studies, so it's incredibly unlikely they are or ever did contribute to the overdose crisis in any meaningful way. The question inevitably remains, why do efforts to mitigate the crisis continue to be focused on public health interventions that have and aim to further limit patients' access to medicine? An astounding portion of the evidence points in the direction that patients in pain were a convenient political externality whose suffering became incredibly profitable and yielded a healthcare landscape complete with increased social control through the healthcare delivery model. This has happened because of the narrative and moral panic surrounding opioids justified by flawed data. All because the system wasn't capable of properly parsing data, and subsequently, it also wasn't correctly interpreted, something CDC has known for some time. It also means many patients have lost access to legal medications despite valid medical applications. The lie that is the prescription drug overdose crisis collapses with the introduction of a little bit of sunlight. Still, at least for now, patients continue to suffer, and those who might be open to getting help with SUDs are still fumbling in the darkness the assumption created, at risk of overdose or death due to IMF's proliferation on the streets and the incessant stigmatization of people with SUDs. The current narrative and policy landscape continue to deny millennia of empirical confirmation of the safety and efficacy of opioid analgesics for medical applications, both for acute and chronic non-cancer pain. What a sad day for science in America if we continue to worship such a lie. Yep. What more is there to say, people? What more is there to say? At this point, I think I'm about in favor of having everyone of the CDC arrested and thrown in prison. I mean, I'm going to even go a little further. Arrest them for treason against the American people. Because the Constitution defines treason as waging war against Americans. Well, what is this? What is this? What are they doing? They are taking actions because of problems that they know aren't problems. Pain patients. And they're taking their pain medicine away, subjecting them to pain, which is a form of torture, driving them to suicide deaths, and even worse. Is that not a war against American people? Then I don't know what is. Oh, it is. It's not fought with bullets and bombs, but what morally and realistically is the difference? It's hard to even find the words to close this part out. Not only is there untold suffering, but permanent loss of life from this war on pain patients. What is it going to take for this to change? Thank you for staying with me through all of this. We'll wrap it all up in the next part. Stay tuned.